A big change in breast cancer screening. The American Cancer Society released new guidelines that suggest less screening may be more beneficial for most women. Fox 12's Laura Rios spoke with a local oncologist. She's live in studio now to break down the change. Laura?
And Pete, this really impacts younger women who have the average risk of breast cancer, not those with high risk like a family history. A local oncologist tells me this reflects a change in how we find and treat cancer, one that's more based on each individual patient. When it comes to screening mammograms, 45 is the new 40. New guidelines from the American Cancer Society say women with the average risk of breast cancer should start getting annual mammograms at age 45 instead of 40. Women 55 and older may switch to getting them every 2 years or keep getting the annual screenings. These changes are not for women with high risk of breast cancer. While some doctors may be concerned insurance plans may decide not to cover costs of early mammograms or that these new guidelines may shift focus from catching cancer early, the American Cancer Society says the change will reduce unnecessary harm to many women.
If she starts screening at the age of 40, she increases dramatically the lifetime risk that she's going to have a false positive result, that she's going to need a breast biopsy that turns out with the doctor saying, well, you don't have cancer, sorry, we'll put you through all of this.
I don't think there's anything magical about being 45. I think it's all about that a younger woman is less likely to get breast cancer, and a younger woman is a lot more likely to have denser breasts, and it's going to be more difficult to use that mammogram. That's not true about every woman.
Dr. Allison Conlon is a medical oncologist at Providence Cancer Center. She says the new guidelines reflect a move toward more individualized care and should encourage women to talk with their doctors about their own risk factors for breast cancer and when to start getting mammograms.
I support any kind of discussion between your provider. I don't think every woman needs to start at an exact age. You know, I think what each woman does is really not dependent on any one guideline.
And the American Cancer Society guidelines also no longer recommend a clinical breast exam. Those are the exams done in the doctor's office. But Pete, the group pointing out that these new guidelines really shouldn't stop anyone from getting any sort of screening whenever they want. If you have any questions, go to a trusted doctor.
Absolutely. Yeah, talk to your doctor for sure if you do have concerns. Laura, thank you very much.